Navigating the health and social care system can feel challenging at the best of times. If you're in a mental health crisis, this challenge is considerably amplified. If you're a non-mental health professional trying to support this group of people, the work can feel really daunting. So we've made a series of films of 4 different mental health crises. Each of the films takes the patient from the home to the emergency department to demonstrate the clinical pathway. They are not meant to be perfect pathways or perfect interactions. They are designed to create food for thought about what it might be like to be the patient or the carer. The films are about 20 minutes long and have been designed to be used in a variety of settings, from the classroom to the individual learner in front of a computer. We've posed a number of questions and issues to help you think about the case, which means the session will take about 90 minutes.
Which service do you require?
I need an ambulance for my son.
Connecting you now.
Ambulance service, what is the address of your emergency?
48 Stanthorpe Road, Streatham.
What's the phone number you're calling from, please?
0208 671 3322.
How old is your son?
20.
What's the emergency? Tell me exactly what's happened.
I don't know. There's something going on in his mind. He's talking about going on top of the roof.
Is he conscious?
Yes.
Is he breathing?
Yes.
Has he been violent at all?
God knows, no.
Does he have a weapon?
Oh, God, no. John's not like that. Look, I'm just a bit worried about him. He's acting a bit strange. He's talking about the MI5 trailing him, and he hasn't been sleeping well for the last week.
Has he done anything to harm himself?
No.
Is he thinking about committing suicide?
Look, I don't know. He's just been acting really strange, and I think he might leave the house. He's pacing around the room.
Is he completely alert?
Yes. Look, he's just pacing around the room. I don't know what's wrong with him. Can you please get someone here quickly?
Okay, do you want me to speak to John?
No, I don't think he'll come to the phone.
No problem. Let John know we're organising help for him now, okay? And please stay on the line and I'll tell you exactly what to do, all right? If it's safe to do so, stay with him and protect him from doing any harm to himself. And let the ambulance crew know of any medication that he takes and what doctor he's registered with.
Yes. Are you going to come here quickly?
If anything changes, please call us back immediately on 999 for further instructions, okay?
That too.
Stars.
Oh, please.
Who is it, Mum?
Come on in, come on
Sorry
in.
for the delay.
It's all right.
Hello. How are you doing?
Hello.
All right. I'm Craig. What's your name?
John.
John. How you doing, John?
I'm here with Mum.
What's your mum's name?
Mary.
Mary. Hi, Mary.
Mother Mary. And yeah, everything's fine.
Do you want your mum to tell me what's going on, or why have you called us?
This is not him.
Right. Okay.
I don't know what's going on.
Okay. So, have you got any medical conditions at all? Do you take any medications, or not got any conditions, or take anything? No. And John, what's going on? Are you hearing voices, or?
It's just I'm doing a project and someone's talked to me. He's helping me.
Have you on the phone at the moment, or you got your earphones in?
No, I don't have a phone. No, it's just.
Okay. Is it alright if Emma just does a few checks on you?
Yeah, why not? Of course. Yeah.
Just do a couple of things like your blood sugar and.
Yeah, blood sugar.
Yeah, just gonna pop a little probe on your finger and.
That's fine.
Yeah. So what's been going on today?
What about a big bag?
Yeah.
Big bags, go travelling, walking like hills and camping.
It's not this kind of bag, that isn't. That'd be a rucksack. I'd have all my camping stuff in.
The paramedic is using really good non-verbal communication skills, like sitting close to John and not towering above him. But at the moment, we don't know what's going on in John's mind. He may feel threatened, and that makes the paramedic vulnerable. What he could try doing is sitting slightly higher up or slightly further away. It makes him less vulnerable, but it still maintains good engagement.
So what's been going on today with you, John?
Just a bit weak, tired. I haven't really been sleeping. I've been trying to focus on my project, and it's demanding.
Okay. So
really demanding.
Did your mum know about this project?
What is happening?
No, this project's from university. My teacher set me lectures, and I've got to create an airflow.
What university did you go to then?
Newcastle. Newcastle's up north.
Yeah.
Newcastle's near Manchester,
Yeah.
near Leeds, near Scotland.
And how come you're not there at the moment? You're just going to take a little drop of blood from your finger, all right?
Little scratch.
Is that all right? Yeah?
Yeah,
Happy with
yeah.
that?
Yeah,
It's
no,
just
it's
going to
fine.
hurt a little bit, and we're just going to test
Oh,
your
I'm
blood.
strong. It won't hurt.
So how come you're not at uni at the moment then, today?
It's the half term, so I'm allowed to come back.
Sorry, it hurts a little bit. Okay, so you've got this...
You're
I've got to do this
half-term
project.
now. Wasn't that before? Haven't you? You're meant to be back by now.
No, I could go and come back when I like,
That's what you
because
said.
it's my project. So,
So what year in university are you in?
I'm in my second year of university, and it's 3 years. 1, 2, some second year.
Yeah. And is that right, Mum?
Yeah, it's in his second year.
He is, yeah. Okay. But
And he seemed, it's fine. And it's just recently this has started to happen.
right,
To
okay.
go on, create that.
So what's
wind flow.
what's going on at the
get some
moment, John?
Materials and
It's 5.2.
5.2. Cool. That should be fine. Might give you a little tiny bruise. And do you take any other kind of drugs at all? Now, when your mum rang us, she said about you were thinking about going up on the roof or something like that.
yeah, because it's for my project. I've got to create this amazing airflow, and then I could just fly off. And it's for a helicopter, and it's really, really constructive, and it will get me a really good job. And I want to do really well and be able to support myself. And
So it wasn't you were just going up on your roof for this project that there wasn't anything you weren't going to do anything dangerous up there or anything like that.
Are you
John.
listening?
John, you're right. You still with me?
yeah, X, Y. It's quite complicated.
So I think we're probably going to have to pop you down the hospital. I think there's a few things going on at the moment.
Are you gonna come with me?
Of course I'm coming with you.
Yeah,
Yeah?
we could go.
All right then. You ready to come out then? Get your bits together.
Just got to get some stuff.
No,
Yeah.
no. I want to stay here. I'm comfortable here.
Yeah.
Thank
John.
you.
Your mum's
Just
going to come
agreed.
with you.
To go to the...
No.
All we're going to do is just go to the ambulance and we're going to have a drive.
No,
We're
I
gonna sit in it and it's going to make lots of noises.
Oh no, I don't like that idea. I want to stay here. I feel really warm and comfortable here. I don't want to go outside.
Oh, I really
Bye.
would like you to go with them, John. I'm coming with
You
you,
really-
too.
you
I think
really
it'd be
will.
Mary, Mum, I'm staying here. I'm okay. I'm okay.
John, you're really worrying your mum.
Yes.
It'd make her feel better if you just came and had a quick chat with somebody.
We've spoken.
I know you've had a quick chat with me, but you need to speak to someone who's a little bit more specialist at hospital.
It's fine.
Don't worry
it's
about
fine. Don't you want to speak to someone so they can understand this project that you're on?
that. John, listen to me. There's somebody I know at the hospital who knows about this project.
Yeah.
Yeah, so if you come and talk to him about it, I think he'll be able to help
X.
you.
He can come here and he can help me.
Yeah.
Let's go there, John.
We-
I
Okay.
think it'd be a really good idea.
Okay, let's go. Let's go
Let's
there.
go.
Come on then, John.
All right, let's go. Let's go right now, though.
All right.
Come on, John. Let's go. I'm going to get your coat on the way down. Let's go.
John appears to be hearing voices. The paramedics persuaded him to go to hospital. Perhaps the voices persuaded him not to. So the paramedic is clearly really concerned about John, and he wants to get him to hospital at all costs. But on the other hand, imagine being the ED staff, and John arrives in hospital, and all he wants to do is speak to somebody who can help him with his project. He's not going to trust anybody else.
Just come round there. Have a seat in the ambulance. Just leave that. Go on.
Leave it.
Just come have a seat in the ambulance.
Sorry, thank you.
You have a seat there. John, you just have a seat on this one, yeah? That's it. John, you sit there. You go and sit down the back. Lovely. All right, John. Just need to do your blood pressure, John. So if you just want to slip this arm out of your jacket for me.
Okay, let's take that off.
Just pop this arm out your jacket, that's it. Lovely. Just pop that round your arm. That's it.
It's okay, it's not hurting.
Alright, just relax your arm down there, and it's just going to get tight on there, alright? And then just do a bit of paperwork.
Hi there.
Hello. Really glad to see you. I'm Mary.
Well, nice to meet you. John? You must be John's mum?
I am.
Nice to meet you. Hi there, John. I understand things have been quite difficult for you recently.
Yes, it has been. John, the doctor's talking to you.
And it's a big building, lots of people around me.
John, I understand that you've had some trouble sleeping and also some trouble with your appetite. So what I'd like to do, if that's all right, is just I'd like to rule out a physical cause for any problems you might have been experiencing recently, if that's okay.
Yes.
And in terms of tummy pain, have you noticed any pain in your tummy at all?
No.
No? Okay. And are you passing urine okay at the moment? Have you noticed anything different passing urine at the moment?
No.
No? Okay. And how about passing poos? Is that all right?
No.
No. Okay, great. I apologise, my hand's a bit cold, but I'm just going to examine you, if that's all right.
Have you got enough space?
I should be all right. Thank you very much. First of all, would you like to put your hands up for me, please?
John, put out your hands.
Try and put your hands up for me. Thank you. For me.
Yeah, what does that mean, what you've done so far?
So I'm just giving him a brief physical check, just to make sure there's not anything wrong with him sort of physically. So I'm going to follow this up with blood tests and a tracing of his heart. And then one of the other doctors is going to come.
Oh,
and
that's like
talk
a
to
maths
him.
test, an English test, and a science test.
Is that
and you
right?
get blood test as well. It's probably in PE when you fall over and you hurt your knee and you got to get plaster, and then that's where the blood comes from, and it's like a blood test.
John. Hi John, nice to meet you. My name's Ruth, I'm a psychiatry doctor here at the hospital, and you must be
His mother.
John's mum.
Mary.
Nice to meet you.
My mother
Hi.
Mary.
I see, okay. John, my colleague Ben, the A&E doctor that you just met, has asked me to have a chat with you. Would that be all right? I understand that you've been having quite a stressful few days.
Yes, he has had a very stressful week. This last week's been really bad.
And I got some of the story about what's been happening. John, are you hearing someone speak to you? What's happening at the minute? Who's speaking to you? X.
Yes.
Who is X?
I'm not telling you.
Why don't you want to tell me?
Remember you told me who it was, John. Why don't you tell her who it was? thinks it's the MI5 that's communicating with him. And they're following him, and they're giving him instructions.
So he's told you about this, Mary?
Yeah, they're training him, apparently.
Okay.
Together. Gotta win this.
John?
Win the game.
John, sorry to interrupt you, John.
Running fast.
Tell me what X is saying to you at the minute.
John.
And then.
John. It's just getting progressively worse.
And then.
Okay, so it's happening a lot of the time.
And then.
John, I heard you mention the word project. What's the project about?
Project University.
But it's not a university project, is it, John?
Me and X project.
Yeah, but it's not a university project, is it?
Okay, so what is the project about, John?
I need to create an airflow. X is helping me, and yeah, go round and round and be successful. Yeah.
So X is telling you how to do this project and what to do. Is that right? Okay. Does X ever tell you anything that causes you to be afraid?
Yeah.
What does X tell you?
Stuff.
Does X ever tell you to harm anybody?
Yeah.
Okay.
Did you hear the question, John?
Yeah.
Does X ask you to hurt anybody?
I can't tell you.
Well, that's not his personality. He wouldn't do that.
No, so you don't think that he would act on anything?
I don't know anymore. I don't know.
John, has X ever told you to hurt yourself or to harm yourself in any way?
I can't tell you nothing.
Can I tell you a bit about what I know about the story? I heard, John, that you were on the roof or trying to...
I was on the roof, and X helps me, tells me to do all these things, and you know,
What's he telling you to do?
I just get a bit like...
John, what is he telling you to do?
A bit frantic and,
John.
you know, but...
John.
What was he telling you to do on the roof, John? John, what did he tell you to do on the roof?
Jump.
To jump from the roof.
Airflow. Fly.
John, that seems a bit dangerous to throw yourself off the roof. Do you not think that would have consequences?
Like a bird. What's the time?
Okay. Can I explain what I think might be going on with John?
Yes, please.
It seems to me that he's talking, as you said, about MI5 and about X. He seems to be holding some unusual beliefs about his involvement with the project. He's described some risky behaviour. What I think will need to happen, I think John must come into hospital for a period of assessment so we can find out what's going on and what's causing these symptoms.
So it'll be just coming in the daytime? We have to stay overnight?
Mum, let's go home. I'm not going nowhere. Let's go home.
We're going to.
No, I'm going home.
Let's just finish talking to
He's told me I've got to go home. He needs me. I'm not going nowhere.
Okay, John, it's all right. Settle down. I'm just telling your mum what the plan is going to be.
I need to go.
I think you need to come into hospital, John, so that we can check what's causing these unusual beliefs. So what I'm going to do now, I'm going to try to organise what's called a Mental Health Act assessment. I'm going to ask two of my senior psychiatry colleagues to come and have a chat with John, as well as an approved social worker, and decide whether John needs to come into hospital as a detained patient under section.
Okay.
But that's what the Mental Health Act assessment will figure out.
They speak to him, that's what they will work out.
Yeah.
Rex, when he comes in, I will be able to come in every day and sit with him, right?
You will.
Okay.
Yeah. Okay, so I'll go and arrange that now.
Yep.
And I'll come back and have a chat with you if you've got any more questions.
Okay. Thank you.
All right. Thank you very much.
I'm not going nowhere. I've got to finish this project with Rex.
John,
I'm not going nowhere.
John, this is going to make you feel better.